I've been in here, you know, we've been talking and everything. Because I'm not suctioning out his air right now, I don't have to bump his oxygen back up for this part. So I'm going to prepare my field. And I know that this middle knuckle touched that paper there, but that's okay because I'm just going to keep that in my mind and hope that nothing else touches that area. Hold on, you didn't see me do this. There's like hairs and stuff in here.
Oh my gosh.
Okay, so now I'm going to dump it. And I want to make sure when I dump it, nothing touches where my finger had touched. And dumped it out. Okay. We used to use peroxide for a lot of stuff to do cleaning around wounds and around their little wires and pins and posts and everything else, but research has shown that hydrogen peroxide can be very harsh on the tissue. So anymore, if you use hydrogen peroxide, you're going to do a 50-50% solution. You don't ever want to put it just by itself on something. So I had noticed when I was doing that suctioning that there was some secretions. His dressing was moist. I didn't see a lot of like thick secretions, dry secretions on his inner cannula, but still, just because I don't know what's down inside there, I'm going to use my hydrogen peroxide because what's it do? Just like for a cut or whatever, it starts to bubble. So any of those dry secretions that's on that inner cannula, it's going to start to bubble and loosen it up. So that when I get ready to use my little pipe cleaner, I can actually, I mean not my pipe cleaner, my bottle brush, I can clean it out. So, and there's like 3 little wells here. And it's kind of hard, the little ones are almost too small for you to do, but I'll show you, how, but in the bigger one, I'm going to put my peroxide, and then my normal saline. And I've checked both of these, the date and time and all that stuff, and they were still good. And then I'm just going to put some in there.
You would pour off before you did that, right?
Yeah. If they hadn't been opened, had been opened and stuff, yeah. Okay, so I've got a 50-50 mix in the big one, and then just normal saline in the 2 little wells. You can reverse it however you want. It's okay. If you want to put peroxide in the little one, but because I'm getting ready to drop it in there, I want it to soak. That's the reason I put the peroxide, the 50-50 mix in the big one. Okay, so that is set up. I still have my sterile field here, but their inner cannula and stuff that I need to clean is there. So the first thing I'm going to do is just put on clean gloves. I can take some breaths and stuff. But it's not necessary because right now I'm just getting ready to set this off to the side. And I'm going to, and this is almost too tight. Your mannequins are not anatomically correct. You don't have like a cuff where your neck and your shoulders meet and your head's not bent down like that. So it is more difficult on a mannequin than it would be on a real person. So anyway, I want to stabilize my faceplate here. I don't want to manipulate it all around. And I'm going to pull this out. And I have a little serosanguinous, pink, not really bloody, but light drainage. I make a note of that, and I toss that. I'm going to unlock this, pull it out. I do not want to cross my stuff, so I'm going to drop it in there, and it's bubbling, okay. And if I want, I can put his oxygen back over him. You can use that. while I'm doing this. Okay, now I've got sterile gloves here. First time I put my right hand in, now I'm doing my left. I just grab. You're going to have Q-tips, that's for cleaning around the stoma, the opening. Your little bottle brush is going to be cleaning your inner cannula. I wouldn't normally take this much time, but I'm talking to you all about this. I've got pipe cleaners, that's what I'm going to use to dry the inner cannula. So I'm going to, right now while I'm sterile, I'm going to go ahead and twist them together to make it a little thicker. I'm going to set that off to the side. Your kit comes with ties. Most places don't use the ties anymore. We have Velcro straps that secure that faceplate. I'm just going to set that off to the side. Now look here. I have a dressing, my little fenestrated, little split dressing. And then I have some 4x4s that I can use for drying. I know that I have a 1-inch margin, so I'm going to make sure that everything is there. Okay, so at this point, my hands are sterile. Once I reach in there and grab that and start cleaning it and stuff kind of starts to splatter, I'm no longer going to be sterile, but you keep in mind that stuff here is still sterile, and you know I'm going to be touching it and stuff. And the reason you start out sterile is because I do not want to introduce anything into his airway. If I just use clean gloves and this, that, and the other, so I still try to maintain, think in my mind, this is still sterile. I'm not sterile, but this is still sterile, and I think about it that way. So I'm going to reach in here, grab this. Now this is wet, so it's going to be dripping. I'm going to step back away from that. I'm going to hold it away from me because if you've ever used a toothbrush on stuff to clean things, you know how it splatters. So I'm going to clean up inside my inner cannula. Those secretions come out of that inner cannula and then they kind of flow over the side. So I want to clean around that. Toss that. Rinsing this off. He's still doing okay, or she, whatever she is. Rinsing that. I want to get. Students have a tendency, they forget the rinse part.
And what solutions are in yours?
Just the normal saline. Okay. I'm drying this off. I do not want to clean around his trach until I get this back in. Pipe cleaner's going up through there. I kind of swirl it as I bring it out just to dry everything.
If you don't get it good and dry, you're going to introduce fluid down into the lungs. What are they going to do? Cause carry on, right?
So I've looked at it. I'm not seeing any fuzz. Is this hand sterile? Can I touch that mask?
Yeah.
Yeah. So I'm going to move that out of the way. Okay. I'm going to stabilize this because I'm not touching this with this hand that I've just moved that with, correct? Okay. So I'm going to stabilize this faceplate, and it goes down. It's curved, so you want to follow that curve. And I'm trying not, again, her chin is in my way. It shouldn't be. And I'm going to rotate this until it locks, so I cannot pull it out. So that part is done. Now I'm getting ready to clean around underneath the faceplate around her trach opening. So I'm going to grab these because I'm no longer sterile, but I'm still trying not to introduce anything. I need to grab this, open it, get these moist, just normal saline. If there had been a lot of secretion, I could have poured some peroxide on it and then poured some normal saline on it so that it's not pure peroxide to clean, and then I would have had to have had more of these, so I could have said, Crisco Light, I need some more sterile Q-tips in here that I would have just poured normal saline on then to rinse over. So, she's difficult, but what you want to do, and I'm going to move this out of my way, and so for her, what I'm going to do is I'm going to clean from 3 o'clock, twirling it, to 9 o'clock. So, from one side to the other, toss that.
Now, is this not sterile anymore because you moved your right hand's not sterile anymore since you moved it over?
Has it been sterile? What was the only part that was really sterile?
It's just when you were putting the intercannula in.
That wasn't even sterile. I mean, at that point, my hands were clean. Only time I was really sterile was when I was setting up my sterile field.
The end of her Q-tips are sterile.
Right.
Yeah.
She's not touching her with her hands, right? So what she's protecting, she is. But
okay, so now this part, I'm going to clean again from 3 o'clock to 9 o'clock, but I'm going this way.
You're rolling it?
I'm rolling it so that it's a different part of that Q-tip is coming in contact with her skin as I'm doing it. And I'm going to toss it.
You're getting that Q-tip underneath the collar?
Yes, yes, it's
Be
going
right
up
at the
underneath that
stomach.
face. Right,
at
yeah.
the stomach.
So I've cleaned. So the inner cannula has been cleaned. The faceplate has been cleaned. I'm going to assess my ties to determine if they need to be changed. They may or may not be. They don't have to be changed every time. You just have to check it and see. These look good. So right now I've made a note that the ties are not contaminated. They're not all moist and soiled or anything like that. So I'm going to leave them in place. So the only thing I have to do at this time now is to put her dressing back on. Okay. So I'm going to set this off to the side even more. I'm going to pull her gown down. To get it out of my way and try not to expose her. My hands aren't sterile. That dressing is sterile. That section right there that's getting ready to go up against her is uncontaminated. So I'm going to fold it over to keep it from getting contaminated with anything. And I moved her gown down just so that there's nothing, any wet secretions on that and stuff. And so now I'm going to slide this up underneath her faceplate. Her skin does not slide, you know, like on us. And so you're going to have more difficulty, but we take that in consideration. So if you're skilling, don't go, oh my gosh, this isn't going, you know, we know that. You know, just don't be going, you know, that's what we don't want to see. So I'm going to get this here. Yeah, thank you. I'm going to sit this in. It's still kind of folded, so I know it's not being grossly contaminated. You can manipulate the faceplate just a little.
When you do, they may cost. Don't you get over it like this. You don't want to loosen the straps, Jamie, because if
That's
they
a
cough,
good question.
bam, it goes, and you've lost your whole trach.
Because that is securing it. That's holding it secure. Okay, so that's in. But that brings up a good point. If you have to change these ties, you want to make sure that you have it snug, that you can get one finger to slide around. That's how loose it should be. If I can get like several fingers in here, that's too loose. That's not a secure trach. So one finger should be able to slide around. That way you know that it's not causing pressure by being too tight around their neck. Because can I really see what's going on back here? No, but I want to make sure. Okay, so that is on there, and that's the trach hair part of this skill.